Welcome back. The British Medical Journal will, for the first time, back an accredited lifestyle medicine course for doctors next week. The increasingly popular practice involves making lifestyle changes to improve mental and physical well-being, like healthy eating and physical activity, social interaction and positive sleeping patterns. There is evidence to support the success of behavioural change, and some doctors believe that it can help reduce overprescription of medication and strain on the NHS. Well, joining us now is Dr. Angela Goyle, an NHS GP and the director of Inspired Medics. They offer lifestyle medicine and social prescribing courses to patients. Great to have you on, Angela. Tell us more about lifestyle medicine. It sounds a little bit sort of flimsy, but actually it's very important. It's about taking care of ourselves so we don't get sick.
Thanks, Alex. Yes, that's precisely what it is. Not only prevention of illness, but also the treatment of illness. And there's lots of evidence out there behind diet, exercise, good sleep patterns, reducing stress and reducing toxins, and how this can not only prevent diseases, but also treat diseases. We know that type 2 diabetes, that this can be treated with diet alone more successfully than with pharmaceutical interventions. But there's a huge reliance in the NHS on pharmaceutical drugs only and not giving enough advice on lifestyle interventions. So back in 2018, I set up courses training healthcare professionals and doctors in lifestyle medicine. And the popularity is really growing. So much so, as you've mentioned, that the BMJ are now collaborating with us to bring this education to even more health professionals and doctors in the UK.
I mean, it seems like a no-brainer, doesn't it? Don't overeat if you don't want to get fat and develop things such as heart disease, type 2 diabetes. You know, make sure you sleep properly, that you have good sleeping patterns. I mean, surely this is what we should be doing as a society. But the truth is, we are doing the opposite, aren't we, in the West? And our lifestyles are having a major impact on our health.
Yeah, absolutely. There seems to be a perception amongst the public and healthcare professionals that pharmaceutical medicines will solve things for us. And that's simply not true. The lifestyle interventions, when I've implemented these with my patients, they have a greater beneficial impact on my patients. So, for example, for depression, if we look at changing things in our diet, sleep, stress levels, spending time in nature, improving our social connection, that has a huge impact on patients with mental health problems and physical health problems. And that training really needs to infiltrate all doctors and healthcare professionals in the UK. It's growing, and I'm really pleased to see the BMJ collaborating with Inspired Medics to bring this training to even more healthcare professionals. But really, it needs to be embedded in every medical school and in every healthcare professional training.
And what sort of top tips would you give to people who, if you're looking through the prism of lifestyle medicine and conducting your daily living in a way that's going to be beneficial for your health, either preventing disease or actually potentially helping to reverse certain conditions? What sort of things would you be telling people to do?
Okay, well, my tips are very simple. Don't overcomplicate it. It's not about buying expensive gym memberships or scrolling through Instagram at the latest fads. Keep it really simple. Start with one thing. So I'm also a regional director for the British Society of Lifestyle Medicine, and we talk about making one change. So think of one thing you want to change, whether it's improving your sleep, so turning off gadgets at 6 p.m. so that you can get a better night's sleep that's more restful for you. Or maybe you know that you're working from home and you're sitting down a lot. And it's not just about being a weekend warrior with your exercise, getting all your exercise in at the weekend, but we need to be moving more on a day-to-day basis, even if that's just going upstairs and downstairs a few times and a quick walk around the block at lunchtime.
So essentially, it's quite easy, really, isn't it? You know, have a sensible diet, packed full of good things, you know, fish, vegetables, meat, avoid processed foods, get a good night's sleep and walk everywhere.
It is actually simple, and that is what is actually quite astounding, that we don't practice this enough. And we make health we overcomplicate it with drugs, with surgery, with lots and lots of conflicting advice about well-being. Actually, it's very simple. Unprocess your diet, get adequate sleep. We tend to know when we're stressed and we're over busy. So these are all things that we can start to address, but also believe that this can really have a significant impact on your health, whether you're healthy already or whether you're wanting to use lifestyle medicine as an adjunct to treat a disease that you may have.
Why is it that doctors now need to be trained on these things? Because they're the medical professionals, they've gone through medical school, they know how the human body works, and surely they should understand that the sort of things we're talking about are no-brainers when it comes to staying fit and healthy.
So I'm a GP, I've been to medical school, I've done GP training, I've done advanced specialist training in dermatology. At no point in that training was there anything on the benefits of physical activity. So we know physical activity reduces inflammation. That then goes on to have a beneficial effect on cardiovascular disease, even prevention of dementia, improvement in depression. There was no training on any of that, or nutrition, or the science of sleep. And that's what I started up in 2018, these courses that give healthcare professionals the tools to learn about the evidence for lifestyle medicine. So they know it's not just soft science. There are some really good studies out there that show you that this is evidence-based, and also techniques that we can use to motivate our patients. Because at the end of the day, you, I, the public, we all want to have the best health that we can get. We want to be healthy for our grandchildren. We want to live we want to live good lives and have lots of energy. And we have to believe that people are capable and want to make these changes. Modern lifestyles don't help. We overwork. We, myself included, probably don't sleep enough. It's easier to reach out for processed foods than it is to cook something healthy when you get home. So there are issues, issues of poverty and social deprivation making it harder. But social prescribing is becoming a big thing in the NHS. And that is really to address those inequalities in health. But I think it starts with an education in lifestyle medicine for healthcare professionals to really understand that these interventions can work to not only prevent, but to treat common diseases.
Dr. Angela Goyle, thank you so much for coming on and talking about this really important topic.